This is Dr. Sajid Maqbool again. I'm often asked about infections in the urinary tract in children. So I thought I would explain to you in this video clip what the urinary tract is, what the infections are, how do children get them, and how are we able to recognize them, and not only discuss the management but also the investigations or tests that need to be done. So the urinary tract of children, or for that matter anybody, starts from the two kidneys that sit on both sides of the abdomen, and from there are two tubes called ureters, which run down towards a single bladder, which is like a container where the urine collects and then it is passed out. That is the urinary tract. And an infection in the urinary tract, of course, means infection anywhere. So the lower the infection is, the less serious it is. So if it is, for example, in the kidneys, then it is considered more serious. And obviously, if it is in the urinary bladder, then it is less serious. So it can occur at any age, and sometimes it's in very young infants, even during the first year of life, actually in the first month of life also. But the common age is much later in childhood, and even older in adolescence, when it has a tendency to become more common in girls. So especially in infants, the infant may have fever and may have vomiting and not much more. So with those symptoms, sometimes it is difficult to diagnose, and the parents as well as the doctor is often puzzled. And if on examination the doctor doesn't find any other reason for the fever, then he has to consider the possibility of an infection in the urinary tract. The other symptoms that an older child may have is frequent urination, abdominal pain, pain on passing urine, or in yet older children, there may be pain in the flanks. Yeah, that is on the sides of the abdomen, and it might be fairly severe. And sometimes in older children, it is also accompanied by chills or rigors. So these are generally the symptoms of the child may feel like passing urine again and again, and it might hurt or burn as the child does this. So in order to find out, the doctor has to examine the child, and in the older children there may be some physical findings, but in the little ones sometimes you don't find anything on physical examination. The tests therefore need to be done, and one of the most important tests that is done is an examination of the urine, which is of course easily done in older boys and girls, but more difficult to collect urine in infants. And of course the commonest way of collecting urine in infants is to apply a urine bag. So when urine is collected, it is sent to the laboratory, and a routine complete examination or analysis is done, and followed by a culture. Now sometimes, depending upon the severity of the condition, a blood count may need to be done, or some kidney function tests may need to be done. That is to be determined by the severity of the situation and your doctor. So after the tests are available, invariably medicines need to be given, and invariably the water intake needs to be increased in a given child. You need to continue feeding, but increase the liquid intake. After the urine test shows an infection, then antibiotics are started, and these are generally given often from 7 to 10 days. Once the infection is cured, the doctor will decide whether there are any further investigations needed for for why the child developed it. Now, a child or an infant develops an infection either from outside, where there may be contamination and it gets up into the urinary tract, or it might come from an infection that occurred in the blood and it traveled to the kidneys, or the child may have some problem by birth where there was obstruction in this system of kidneys, urinary tract, and the bladder. And so for that, oftentimes an ultrasound is done of the abdomen to highlight the kidneys, the ureter, and the bladder. And sometimes, of course, there are other tests which are more sophisticated, may need to be done. So be aware of the fact that infection can occur. Most of the time these are one-time infections, but if it happens again and again, then tests need to be done and greater care needs to be taken so that the child does not develop a tendency towards infections and does not have any possible harmful effects on the kidneys as he or she grows up. I hope this has been found useful. We'll meet again.